Okay, I was born in Scotland and I studied at the University of St Andrews. Medical training was in Manchester, Liverpool, Glasgow, and then Leeds, where I finished my training. And then following that, I studied the weight loss surgery in Australia, United States, and then I spent some time in Vienna learning weight loss surgery. That was due to a man called David Johnson, a very famous surgeon from Leeds General Infirmary, where I was a lecturer for 4 years. David Johnson started performing weight loss surgery in the 1970s, at least 20 years before everyone else had actually thought of it. And while I was in Leeds General Infirmary, I did quite a lot of cancer work where we resected cancers of the stomach and the gullet and the liver and the pancreas. And at that point, David Johnson told me that the future of upper gastrointestinal tract surgery would be weight loss surgery, that cancer surgery had reached its limit and there was no further to go, and that further developments in upper GI surgery would be weight loss surgery. At that time, everyone thought he was mad. No one listened to him, and sure enough, he's been proven correct. Weight loss surgery for upper GI surgeons now constitute 90% of the work, whereas 10% of the work is cancer work. So David Johnson could see that 30 years ago, and it's down to him that I do weight loss surgery. It was him that directed me to it. The first thing I think a bariatric surgeon has to obtain is a fellowship in bariatric surgery. I think we all undergo training in surgery of the stomach and the gullet and the intestines, and we all reach a certain degree of competency with that. But I think with weight loss surgery, it's so specialised that surgeons have to undergo extra training, another 2 years on top of what everyone else does, to specialise in weight loss surgery. It is rather unique, that type of surgery. So I do think obtaining a fellowship is very important with weight loss surgery. I think the second thing about weight loss surgery is the surgeons have to perform all types of weight loss surgery. So one size doesn't fit all, and a surgeon who only performs one type of surgery is not providing a good outcome for his patients. So I think a weight loss surgeon has to perform all types of weight loss surgery, not just one of them. And then I think the most important thing about a weight loss surgeon's practice is the multidisciplinary team approach. They have to have bariatric physicians, we have to have dietitians, exercise physiologists involved in the patient's care, because it's not just about weight loss, it's about making the patients healthy for the rest of their life. I think my training experience and my perfectionism. I've been really lucky in that I've been trained by the best surgeons performing weight loss surgery in the world, from David Johnson, George Fielding, Dan Cotton, Gerard Prada. I've been lucky in my training. Second of all, experience. You know, performing over 10,000 weight loss surgeries has given me great experience. And I've learnt myself going along that journey with those 10,000 cases. And finally, I think my perfectionism. I think I do not accept second best, and I think doing the perfect surgery at the start sets the patient up for a good weight loss journey. We have 3 centres in Western Australia: Hollywood Private Hospital in Nedlands, we have St John of God Hospital in Subiaco, and Glengarry Hospital in Duncraig. I tell all of the patients when I first meet them that it's a partnership. 50% of the success is down to the surgeon, 50% of the success is down to the patient. After 10,000 weight loss surgeries, hopefully I've got it correct, and I can tell the patients I'm going to provide them the tools to achieve the weight loss. So the ideal patient is one who's motivated to lose the weight, and one who's dedicated to lifestyle changes also over the long term, not just for 3 or 6 months, but are willing to change for the rest of their life. So I reckon 50% of the weight loss comes from the patient. I had a 40-year-old patient, an Italian-Australian, who many moons ago had a procedure from which she lost 50 kilograms. She had polycystic ovarian syndrome, was unable to conceive, and her husband didn't like going to family gatherings because everyone else, her brothers and sisters and in-laws, had lots of children. And then one day when she came to the clinic, she was a bit more grumpier than normal and told me that she was unhappy because she'd lost 50 kilograms, thought she was going to get healthy, but unfortunately had gone into early menopause. She hadn't had a period for 3 months, and we did a pregnancy test. It was positive. And I have to say, she's the happiest mother I've ever come across in my life. So there's the IFSO, the International Federation for Surgery for Obesity, which is an international association which all weight loss surgeons are part of. And similarly, we have our own local one called ANZ-MOS, Australia New Zealand Metabolic and Obesity Surgery Society, which again, all weight loss surgeons are part of. Both of them have annual regular meetings where most weight loss surgeons attend.